My name is Michael Meacham. I'm a sophomore at Grandview University, and I'm in the nursing program here. People were kind of like shocked that I wanted to be a nurse. People would always be like, "Oh, I didn't see you doing that." We were kind of confused as like why nursing and not like something else. So I thought about being a doctor and being a psychiatrist. Talk to people and then kind of like help them work through things along with like prescribing medication. And my end goal is to really just help as many people as I can. It's kind of tough to decide like what I wanted to do, because I knew that I wanted to help people, but I didn't know exactly how. I want to go into mental health. My first thought is with mental health, like to have a perspective of a male, just because everyone's so used to female nurses, is less like negative, but more present, if that makes sense. People will still kind of be like weird and awkward about male nurses. You just have to be as professional as possible to really make sure that it's not as present. Remember that there's a patient, like your patient's a human being, and treating them like a human being can really combat awkwardness. I know like sometimes as a guy in the nursing program, you kind of feel like you're on the outside a little bit, just because it's different. I think it would be interesting to see maybe there are patients who work better with males or work better just because of how like we process things and how we experience things, and just the way the world works as being a female versus a male. You need a female to kind of just like be more caring and like listening and things like that. And maybe there's a patient who just needs a nurse to just come in and just do what needs to be done. And I think a change in how like the job treats us and how like patients treat us. We just learned recently that like 80-something% of nurses are Caucasian versus any other minority race group. So I would say like tasks are definitely pointed one way or the other, but I don't think it's necessarily like a negative thing.